And welcome to the Dr. Bob Show. We'll be spending most of this show talking about plastic surgery. 18 million plastic surgery procedures are done every year in the United States. It's anything from lifting up the top of the head to contouring the waistline. It'd be nice to get rid of that inner tube that I've got. We'll be talking about how the plastic surgeon does that and what procedures he does most frequently. My guest is Dr. Ed Breazeale. Dr. Breazeale is a board-certified plastic surgeon, and he's been involved with plastic surgery for the last 20 years or so. He'll be answering our questions about would plastic surgery be something beneficial to you and to me? Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show as we're learning about plastic surgery and how I could improve my looks. A lot of information for you. You'll enjoy this show. We're talking with Dr. Ed Breazeale, board-certified plastic surgeon, and we're talking about plastic surgery in the year 2021. Ed, welcome to the Dr. Bob Show.
Thanks for having me today.
It is so great for me to be able to look at the work that the plastic surgeon does. I've watched your work for 10, 15 years, and your reputation is impeccable. Let's start with the eyes. You see a lot of people that have problems with droopy eyes, both the lower eyelid droops down or the upper one covers. Tell me about the eyelids.
Yeah, I think in the aging process, that's where you start showing some of your age first, is in the eyes. And particularly, it's not fair, but I think females judge themselves a little more critically around the eyes because of makeup and putting things on and what they see on TV or magazine covers. So people start seeking information about the eyes for sure earlier on.
Can they think too early? Can they say, you really don't need that much? Or you walk in and say, well, sure, I'm glad you came in.
Yeah, some of it has to do with genetics. Certain people have heavier eyelids like I do. Others have a more cleared out eyelid that's a little more visible. So I think it varies patient to patient and age to age because no one fits a profile.
If somebody has more trouble with the lower eyelids or the upper eyelids, which is the easiest to change?
The easiest surgery is the upper eyelids. It's more about taking just some skin, and you have a couple of fat pockets up there that we can tease out. The lower eyelid surgery is a little more difficult and complicated because the lower eyelid is generally softer and less elastic, especially as we age. It gets more elastic, less elastic, and it starts to drop down more.
When people have blepharoplasty, eyelid surgery, they seem to really be happy with their surgery most of the time.
Right.
Is that what you see? Most people get good results?
Yeah, I think most people get great results and they're very satisfied with it. Sometimes the brow complicates that too because of the heaviness of the brow, so they might need a little brow lift in the process. But I think in general, if you ask 100 people, 99 are going to be pretty darn happy with their blepharoplasty result.
I've watched some people on television, presidents who are working hard and they're up all day and all night, and they get large bags under their eyes. If you correct that, if you make that where it comes back to normal, is it likely because of the stress of their life that it goes back again, the skin relaxes?
Actually, once you fix it and take care of the problem, it's pretty good for a while. So I don't worry about them for the next 10 or 15 years now. When they get 20, 30 years down the line, they may loosen up a little bit. But I think a lot of that has to do with their genetics as well.
You mentioned the eyebrow. What do you do with an eyebrow?
Well, the eyebrow can sit a little bit too low like mine is today. And, obviously if I could pick my whole eyebrow very easily, that'd be nice. But I'm a guy and I don't have a lot of hair to cover things. The female patient is at a distinct advantage because they have more hair.
And they can manipulate that hair.
They can cover the scar better. The scars are usually very good at the end of the day. But yeah, you have to put them in good spots, and guys, we just don't have a lot of places to hide them.
What about the little lines by the cheeks? They seem to be accentuated in some people. What do you do about those to smooth it out?
Well, that's called your nasolabial fold. And so it's a natural fold that all of us have. As we age, the fold becomes a deeper crease to some degree. And it's not because the fold is deepening, it's because the tissue around it is moving toward it. So early in life, you can sort of magically cover that fold by injecting into the fold using some of the fillers that are available to us. But when you get past about age 50, you got to start thinking about facelift.
Yeah, so you got to move the cheek out of the way where you don't have the line.
That's 100% correct.
Let's walk on down to the lips. What do people want when they come into your office as far as the lips go?
Well, I think that's highly varied. I mean, some of the younger girls want fuller lips. Again, they're influenced by what they see on TV and on Instagram and all the social media type things. The average person just wants a little bit more fullness to the lip roll or the border of the lip. Get that a little more accentuated. Sometimes a little bit of filler into the substance, the body of the lip, the pink part of the lip. But that's an art, so you want to really have an injector who knows what he or she's doing. And then there are some who want too much, as we've all seen. And I think that's unfortunate, but that's what they want. So sometimes that happens.
So in order to get the lip the way the person wants it and the way you think they should have it, do you start injecting in the middle and go toward the outside, or you start in the middle? How do you design that?
You can go either direction if you want to. It's the middle to the outer or the outer to the middle. Every injector does that differently. It's kind of a style that they have or what they're comfortable with. But I think what you do is in the process, while you're doing it, you stop fairly frequently and then you talk to that patient and you ask them, how's that looking? What do you think? Is that enough? Is that too much? Are we getting where we want you to get? And
you do that with the procedure?
You try to involve,
while you're doing it?
Yes,
Wow.
Yeah, you try to involve them in that process because now the fillers usually have some lidocaine in it, which is a numbing medicine. So the pain that used to be involved in lip injections is a whole lot better than it was many years ago when all we had was collagen, and that hurt. So.
How do you know there has to be different brands of fillers? Are there ones that you like better, ones that everybody likes better?
I think some of that's injector dependent, but what it has to do is with the size of the filler that you're injecting. So the molecule or that piece of filler, think of them as a bunch of little round balls. And you have some little tiny ones that are super thin for really technically thin areas, and then you have bigger fillers or bigger molecules that you can inject into the cheek or into the chin that take up more space and therefore give more fullness.
How long do the fillers last? Do they last a short period of time, long period of time?
No, they do pretty well, usually about a 9 to 12 month process. So it's not bad. And, back in the day, it used to be a 3-month thing, but now we've gotten it stretched out to about 9 months to 12 months. So maybe once a year, people are looking at redoing.
Yeah, and can they tell their lips back to where it was? It's time to go see Dr. Ed?
You better believe it. They know quite well because I think they get used to it and they enjoy it, and then they want to be back there again. So,
I see some people their face looks like what I call skeletoid. It looks like they may have been in a prison camp and been starved, and they get sunken cheeks right in here. Do you move the cheek to the side? Do you put something in to fill that? What do you do for that?
Yeah, some faces are more difficult than others. I mean, looking at myself, I'm a fairly full-faced person, so I've got plenty of stuff to move around. You'll see certain individuals that have a real narrow face, and they're certainly more challenging, and so that process is just individualized patient to patient. Most of the time, if they're really deeply sunken, you want to try to get a facelift done where they're back in normal position Then you make the choice sometimes about whether do you add volume with a filler as a secondary procedure.
When you do a facelift, is there a certain design that fits most people as far as where you start?
Well, the incisions for a facelift are pretty standard. You know,
And that's what we're going to be talking about when we come back. It doesn't sound standard to me, but if you have a facelift, there is a standard way to where you start the surgery to get the end results that you want. We'll be learning about a facelift. Wonder what it would do to me. Stay tuned. We're talking with Dr. Ed Breazeale, board-certified plastic surgeon. We've talked about the eyelids, blepharoplasty. We've talked about the lips, lip fillers. We've talked about changing some of the parts of the face. And then we began to mention facelifts. Now, I'm not sure I'm well educated in facelifts, and I'm going to learn. Ed, tell me about a facelift. You said something about sort of a standard outline?
Yeah, if I were going to mark it on myself, it's a little hard to show, but typically you're starting your incision somewhere in the temple or pre-hairline area. Then you follow the contour of the ear. I don't like going straight down. I like following the curves of the ear. You go behind the ear up to about 2/3 of the length of the ear, across the bone, and then along or into the hairline. So we're basically a seamstress or a tailor at that point in time. We're making that seam so we can push the skin back and take the skin back.
Do you pull it back or push it back?
It is pulled back. It's a little more technical than that, but what we do is we undermine or go underneath the skin, and then we're going to do a lot of stitching and moving of critical parts, you know, maybe positioning a fat pad up in the cheek to get more fullness, or the bands of the neck. We're trying to get those bands snugger and tighter to give you that more youthful neck that you had 10, 15, 20 years ago.
Do you design that according to the patient and with your examination before the surgery then?
We do. We draw the seam, if you would, before. And everybody's built a little bit different. Their ear shape's a little bit different, but it still follows a fairly close template. Where the real business is done is once you get the face lifted up, then it's identifying the structures underneath that you need to move around. And that's way different from patient to patient. So there's a little bit of an art form to it for sure.
Is there anything you do from here, pulling the skin on the forehead up?
You can, and traditional brow lifts would be a cut all the way across the top of your head, and that had all kinds of issues with nerves and things like that, but you can get that really drastic brow lift, and I think that's kind of fallen out of favor for the most part. Most surgeons now do something with small incisions at the hairline, do an endoscopic brow lift with a scope, or out here in the temporal region, sometimes we extend that facelift incision up a little bit to get a little lift at the corner of the eye.
Now, I would think that the end results of a facelift would be a lot dependent on the suturing, how good the suturer was. Is that true, or is it mainly the design?
I think it's a combination of both. I think the design is critical, but I also think the quality of the scar probably has 15 or 20% to do with who does the sewing. The other 75–80% is pretty genetic. It's all about how you scar. The good news is with facelifts and eyelid surgeries, etc., anything on the face, typically the scars are pretty darn good.
You know, I can't tell when somebody's had surgery on their eyes or surgery on their cheeks or facelifts. I look and try. I wonder if this.
I think you can tell if they had a bad one, right?
We hope I can never tell.
Exactly. But if they've had a good facelift or good eyelid surgeries, you're right, they're pretty difficult to detect.
Let's drop down to the neck. A lot of people, especially as we get older, get a rooster tail right here, or an accumulation of soft skin there. Right. How do you handle that?
That's part of the facelift. That's the neck lift portion of the facelift. And again, once we get underneath and undermine and free all the skin up, we're looking at that muscle that causes that band. That's called your platysma muscle. That muscle needs to be tightened, and we tighten that up to get that neck snugger. That's done with stitching, and then again, we're taking out the extra skin. So it's like pulling the sheet.
So the platysma muscle, as I remember from back in medical school, was a muscle of fright.
Yeah.
And can you make that muscle stronger where it does a better job?
No, not really. And you probably don't want to over-exercise it if it's already loose, because I'm afraid it might make things a bit looser.
Sure.
But no, those little machines you see on TV and the neck exercises and all that stuff, they don't really help. So
They give the patient something to do.
exactly, and they think you're going to get a good result, and they don't typically.
Common plastic surgery is breast augmentation, make the breast
Right.
bigger, or to make it even smaller.
Right.
Tell me about breast augmentation, how it's done now, if they're using silicone implants or if they put fat in the area. The breast is fatty tissue, isn't it?
The breast is a combination of fat tissue and breast tissue, so it depends on how much a person has. But the implants now that I use specifically are typically mostly all silicone now. The silicone scare is kind of gone now. It was kind of overblown in my opinion, but the quality of the implants now are better than ever, and their safety profiles are excellent, and I have no fear putting those in.
So when you put in an implant, let's just say on the left side, you put them on both sides, so let's take the left side. Is it come in like a plastic bag with stuff in it?
Yeah, the breast implant itself is actually a silicone shell of the implant, and the internal part of the implant now is silicone gel. So it's all silicone. It comes pre-filled, pre-packaged. You can't adjust the size of that particular implant. So if it's a 400 cc implant, it's a 400 cc implant. And basically you're designing it to fit the breast of that particular patient. You know, you don't want to overdo it and overstretch them and things like that. So I try to do it with their anatomy in mind and some certain measurements I do, and I say I think this is the biggest implant I would ever put in you, for each patient.
So if you took a breast away, you've got the rib cage, you've got some muscles over the ribs. Where do you put the silicone implant? Do you put it next to the ribs or between muscles? Where do you put it?
Yeah, there's two different methods of putting an implant in. One is submuscular, below the muscle, or above the muscle. And typically I try to go below the muscle, but even then your pectoralis major muscle, which is this big muscle of the chest, your breast sits on top of that. Behind it's the rib cage. So ribs, muscle, breast. We make an incision typically in the crease, and we begin to get directly underneath that pectoralis major muscle and dissect and make a pocket for the implant. You put the implant in, and in reality, a submuscular or subpectoral implant is only covered by about 50% muscle. So it's this portion of the implant out here on the outer edges is not covered. It's below just the tissue.
Since you've got silicone, I guess the silicone implant, is that what the liquid is, a silicone liquid?
It's really not liquid anymore. It's the implant shell is made from a silicone. You can cook it. So when you cook it and you add carbon to it, you can make it into a hard form or a soft form or a liquid form. And the shell is not real hard, but it's hard enough to be a shell. The internal piece now is if I took that implant and cut it in half, it won't leak out anymore. It's like a gummy bear if you think of it that way.
So you can get the texture that's more like normal breast tissue would be.
Sometimes better. It's really nice. It's like if you've ever had a worry ball in your hand and squeeze that worry ball, it's very similar to that feeling. So,
to me, you're getting to be more and more magical in replacing tissues like one would want them to be.
Right.
Most people happy with their breast augmentation?
I think so for sure. Absolutely.
Yeah, it must be a nice thing really to see people think well of themselves. Do you ever do it where you reduce the size of the breast?
Oh yeah.
And we'll be talking about that when we come back too. We've made them bigger, now we're going to see who needs to make them smaller. You'll want to stay tuned. We're talking with Dr. Ed Breazeale, board certified plastic surgeon, and he's been making me feel like, hey, maybe he's made some changes that'll make me look better. We've talked about fixing the eyes, fixing the lips, fixing the face. We've gone down to the neck. And then we started talking about breast augmentation, increasing the breast size. And now we're going to talk about who wants their breasts smaller. So do people come to your office saying, my breast size is bigger than I want, can you make it smaller?
Sure, it's a pretty common thing actually. If you looked at the world of breasts, more people want to be implanted, but there is a very large number of women who want to have their breast size reduced or at least have their breasts lifted up.
So what is more difficult? The augmentation, making the breast bigger, or making it where it's smaller? I would think making it smaller is hardest.
It's much more complicated surgery doing a breast reduction or a breast lift. Breast lifts and breast reductions are kissing cousins, very similar operation. The lift is about repositioning and getting the breast back to where it used to sit. A reduction is the same, but you're taking lots of tissue away. Yeah, so that's basically the difference there.
Either one more difficult, or either one more painful, or beneficial?
Interestingly, I think the people who love you the most out of your whole practice are the breast reduction patients.
How about
you
that?
change their lives probably more substantially than anybody else. Their breasts have always been large, they've been in the way, they aren't able to exercise or participate in certain activities, or they're self-conscious about that size, and they have lots of back and neck pain. And when you get those breasts reduced back to a good spot, the neck pain goes away.
Posture gets better.
Posture improves. They want to participate in more sports, and probably from a health perspective, it's one of the better things that we do.
It really increases the size of my smile when I see something like that. That really, it has a very positive effect on the total person.
Sure, and I just had a lady in the office today who did a breast reduction on, and you can tell just from her personality how much happier she is, and she is smiling bigger, and you can see that in them, and it's a very fun thing for me.
It must be very gratifying. Let's walk down to the waist.
Okay.
Let's talk about getting the inner tube out of the way. Liposuction, I guess, would be the way that that's done, or tummy tucks. So talk to me a little bit about those.
The first thing we try to encourage patients to do is lose what they can on their own. Some people we're successful with, some we're not. But what's left behind, then the question becomes, can we do liposuction, which is less invasive? It looks rougher and meaner, but we're doing it through small stab incisions with the metal tube suctioning the fat out.
Can you suck fat tissue out easily?
It's pretty direct, yeah. The cannulas are hooked to a suction device, negative suction. You have holes in the end of your tubing, and you're moving back and forth like a violinist, in the right places and suctioning that fat away. So liposuction's been around for a long time, and it's going to continue to be around for a long time.
Does the fat that you've sucked out, does it grow back?
Once you have a fat cell removed, it actually never grows back. Now, the fat cells that are left behind, you can make bigger. So that's where you have to be careful. It's not a weight loss type procedure at all. What it is, it's a body contouring procedure. So trying to make the flank or the love handle area narrower so you have a thinner looking waist, maybe suction the belly a little bit to make it thinner. But not everybody's a liposuction candidate. Some people are too big. Some people actually might need a tummy tuck, which is the big cut and taking away the skin and the fat.
Tell me about a tummy tuck. Why do people need or want a tummy tuck?
Probably the most common reasons are ladies who've had 2 or 3 kids, something along that line, a lot of stretch. That skin never quite wants to go back to where it used to be. And you see a lot of weight loss patients who've lost a lot of weight and they want to get that loose skin removed. So those are your common ones.
From the design of fixing things with a tummy tuck, get good results with that?
I think so. We try to hide the scars as well as we can along the bikini line, keeping it out of sight, out of mind. But yeah, you can get some pretty impressive results by taking the skin away.
I've just really enjoyed this show. I've really enjoyed listening to what the plastic surgeon is able to do to change the lives of people by meeting certain designs and certain goals that we have. Breazeale, I want to thank you times 10 for coming on the Dr. Bob Show and teaching me and the viewing audience.
Thank you for having me. I enjoyed it.
It's my pleasure. Remember those 4 things that we like in the Dr. Bob Show. Be sure that you're exercising. How long? Well, you want to do it 150 minutes a week. So try 30 minutes 5 times a week and see what you can do as far as that goes. A little bit more aggressive activity after you've talked with your doctor would be better. Remember, sleep is so important to life. So you need to get 7.5 hours sleep. You'll be happier. You'll perform better. You won't have that fog over your head. And while you're sleeping well, start that day off with a good breakfast. Breakfast is a very important meal. A lot of fruits and a lot of fibers. So we've got exercise, we're eating properly, we're sleeping properly. And what is it that we like the most in the Dr. Bob Show? It's that giggling and it's that laughter. It's that ability to enjoy life, to enjoy yourself, to enjoy the people around you. So find that person that you love, tell funny stories, talk about life, talk about what you've watched on television, enjoy life, and you'll be happier and healthier for the rest of your life.